This is Khalil Hachem at WDMV, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. Welcome to this sunny day in the cold land of Michigan. We have a very special program for you. Today I will be teaming up with Layla Al-Husseini, founder and CEO of US Arab Radio, to discuss very important efforts by the state to spread awareness about the coronavirus. US Arab Radio, as you well know, is the leading ethnic radio in North America, attracting millions of listeners in the US and the world. And, as you well know, the biggest news today, or has been for some time, is the coronavirus and how we are responding to it, how much information are there, and the distrust and so forth and so on. And the state has been leading quite a bit of an effort to help residents understand what's going on and what they need to do and how they need to do it so we can stay safe. I would like to welcome to the program Fayrouz Saad. Ms. Saad is a public policy expert who has worked at every government level as an appointee for President Obama and Detroit Mayor Duggan. She currently serves on Michigan Governor Gretchen Whitmer's cabinet as the Executive Director of Global Michigan. In this capacity, she leads immigration policy, immigrant integration, and economic inclusion programs for for the state of Michigan, that is. During the pandemic, Global Michigan has led outreach and response efforts to these communities, ensuring COVID-19 response programs and policies are inclusive of community needs and challenges. Ms. Saad, good morning.
Good morning. Sabah al-khair.
Yeah, hello, sahla. Thank you so much for taking the time to be with us and to share some news with our listeners. Please tell us a little bit about you and what you do in that capacity and what's the program about.
Thank you. Well, first of all, thank you to you and Layla and, of course, your listeners for having me here today and allowing us this opportunity to talk about such an important issue. As you mentioned, I work for Governor Whitmer. I lead an office. I'm the executive director of the Office of Global Michigan, which some people might know it formally as the Michigan Office of New Americans. Essentially, my office, we work on a number of things, but the communities that we look to serve are, like immigrant, refugee, the international community at large, communities that there might be language barriers, cultural barriers, and other things that are potentially serving as a challenge for them accessing or using state programs and resources. And so we work across state government with our colleagues to make some of these programs more inclusive to our communities to ensure that all communities in Michigan are able to thrive, economically. And so specifically now, during the pandemic, we've been working on a number of things, starting with when, it was just the virus and we didn't have vaccines yet. We worked to make sure that the materials and information being released about the virus were in 6 different languages, Arabic being one of them, of course. So that's just one very kind of simple example of where we play a role, how we work to serve communities with a lens of state government resources and programs.
Yeah. What other programs do you work on other than the COVID-related issues right now?
Yeah, so let me tell you a little bit about the structure of my office. So the Office of Global Michigan, it has a few programs in it. We oversee the state's refugee resettlement program. So essentially we oversee all resettlement that occurs across the state of Michigan. We fund the mental and health services that are conducted by a lot of organizations on the ground, like Access and ACC, some that, the Chaldean Federation. And then we also have a workforce development program, which works to lower barriers for immigrants and refugees and those that are specifically have degrees from overseas, so might be trained as doctors or lawyers or accountants overseas, but have challenges working within their professionalized field here in Michigan. And so this program helps to open up barriers for people like that, help kind of make sure they have access to workforce development program. We work with our licensing division to see how can we create pathways for those that are trained overseas to kind of return within their professionalized field. So I always give examples of, we all know, someone who was a doctor back home and loves being a doctor and comes here and for so many reasons can't work as a doctor because of licensing barriers, because of home life, and can't go back to school and take his MCATs and start all over. And so what we've done is try and we help folks like that kind of look at what other fields might be available to them. Maybe there's lower barriers to entry. Maybe some of their skill sets and their degrees from overseas can transfer into that field. Maybe it's a nurse, maybe it's a medical examiner. So that's just another example of some of the work that my office does. And then we also see this state's 3 statewide ethnic commissions. So there's a Hispanic Latino commission, there's an Asian Pacific American commission, and then there's a Middle Eastern commission, of course, as well. And those are all individuals appointed to those commissions. The Middle Eastern Commission are all of Middle Eastern descent, all Michigan residents, and are all appointed by the governor.
Absolutely. That sounds like a lot of work. And the aspect of it of helping professionals get adjusted to their new home and then work in their capacity is incredible. Over the years, I've talked to a lot of, we interviewed a lot of professionals, before this office was started. And, the frustration on their part to, as doctors, engineers, and so forth and so on, and they were just driving taxis. It was a huge frustration. So that's incredible. Now with the COVID, what do we need to know?
Yeah, where do we start? So, I think the most important thing is that we need to know where to get the information of what we need to know. And so I think especially in today's world where we're so digitalized and we're so connected, right? We have WhatsApp, we have Facebook, we have Instagram, we have you name it, right? And while these tools have all been a great way to connect us with our family and friends across the country and across the world, I think unfortunately sometimes they also serve as these proxies where we get information that isn't correct, where it confuses us, where it just really muddies the waters of what is out there and what do we need to know. And so, I just, first of all, encourage everyone to not rely or trust these, technologies as the best way for the best and most accurate information. Please go to the Michigan Department of Health and Human Services website, the CDC website. There's another website about the vaccine, ivaccine.org. And then, of course, we have specifically set up a website with all information about the vaccine, which is just michigan.gov/COVID vaccine. And on there, in addition to finding all the information we have right now in terms of how to sign up, where to go, what's available in your county, because it's different county by county. It's also available, most of the information up there is also available in different languages. So if you do not speak English, you can find it in Arabic, you can find it in Spanish, you can find it in even Burmese in some cases. So I would say that first and foremost. Please, go to some reliable and trusted places to get your information. Second thing,
Absolutely.
I think there's a lot of confusion about who is available right now. So, as many of you probably know, unfortunately, there is just not enough supply out there. We know people want it, and we want to get to a place where everyone who wants a vaccine can get a vaccine. Sorry, were you going to say something? Did I interrupt you?
No, I just wanted to agree with you on the fact that first I would like you to repeat the website, the Michigan.gov. Is that right?
Yep, Michigan.gov/COVID vaccine.
COVID vaccine. Okay. COVID vaccine.
Mm-hmm.
The other thing is that, and we can't really blame people for the distrust, because we've had, when this whole thing started, we've had conflicting information about what to do, what not to do, and what is and what's not. And then I understand that we didn't know much about the virus. And, one day you can wear a mask, another day you can't wear a mask, so forth and so on. And that created a little bit of, like, who should we believe and what should we believe? So to that background, makes it really tough on you guys to spread the correct information. Now, the question is, not everybody really is savvy enough to go online and read and all of that. People consume media. What are you doing to reach out to, outlets like U.S. Arab Radio and others so they can facilitate that information for you?
Yeah, and I appreciate the question because it's so important. I think one of the things my office has been doing is really identifying where are the inequities, where are the challenges specifically to our Arabic-speaking residents, Spanish-speaking residents, so on and so forth, people who maybe aren't tech-savvy or maybe even don't have a computer. And so that is why we've set up something called the Protect Michigan Commission. And actually, really quickly, I do want to give, because there's a hotline as well that people can use, and that is 888-535-6136. And that's Monday through Friday, 8 a.m. to 2 p.m. 8 a.m. to 5 p.m. And they can also call 211 and get information in multiple languages. So I did want to put that out there because not everything is just online.
Sure.
But that said, to your question, so there's a few things that we're doing. One, we've established a commission of residents from across the state of Michigan to help us do exactly what you're saying, is lead us in the direction of how we can make sure that everyone who wants a vaccine can get a vaccine, and that have access to a vaccine, know how to sign up, right? That it's culturally sensitive and available in languages, someplace where they can get it, so on and so forth. And so, through that commission, we've established different working groups as well. So we also have a Middle Eastern working group, an Asian Pacific American working group, a Hispanic and Latino working group, to specifically address the needs of the different communities. And so within those working groups right now, we're talking about exactly what we need to do to set up maybe mobile clinics in different our communities across Michigan, like Dearborn, for example, where we know we have a big Middle Eastern community. We have a large Arabic-speaking community. And so that it's in somewhere where it's in a trusted place, right, where people know, people are comfortable going, and that also where there's people who speak the language that they're comfortable communicating in. So that's one thing that we're doing. You asked about media outreach. That's something that is ongoing. I believe you all may already be a hub and where we place public service announcements and information about the COVID vaccine. But we're always identifying what other media outlets are trusted by the public that we can work with to continue to be a
Absolutely.
source of information where we could place ads.
And that's the key, trusted. It's very important because there's a lot of bad information out there and conspiracy theories and so forth and so on. But even then, I mean, we really haven't gotten to the point where we have given vaccines to everyone who wants it. So, but I appreciate what you're doing to make sure that the next step is being taken care of. Are we where we need to be, or we still have a lot of work when it comes to the vaccine?
Look, I think when we're in the middle of a global pandemic, and people are dying, I think we're always trying to get to a better place. So I think that I'm certainly not resting. I'm not making any assumptions, and I'm trying to do my best to make sure that I have my pulse on the needs of the community as much as possible. And I believe my colleagues and of course the governor are feeling the same. They just want to make sure that Michigan residents are protected and anyone who wants the vaccine can get a vaccine. So I think there's always room to grow. Like I said, that's why this commission was established. And in addition, the working groups, because we know and we recognize that we're not going to on our own know what every community needs and what the different challenges in each of the communities are. So that's why, and Dr. Obaid, who I think will be next on the show, he's the chair of that commission and an incredible resource for us and the community.
Absolutely. What kind of feedback you're getting from different communities, specifically the Arab American community?
Yeah, so, I think some of the things that you've already asked and outlined are, it's clear that you have your pulse on the community as well. You're in there, you understand. And that is, wanting to know when more supply will be available, when people who want it, who maybe aren't eligible now, can get it. So a lot of these questions about how can I get it? When can I get it? When will more be available? Unfortunately, we don't have a lot of those answers yet. Right? We're all waiting kind of on the federal government to kind of go through their process and for it to get to the states. And then, I think that people are growing frustrated with the number of different information sources that are out there, and like you said, it's not anyone's fault. And I certainly don't blame individuals for believing what they see maybe because a friend or family member sent it to them via some outlet. And that's why, again, it's so great to be here with you and to have Layla have invited us, because I think that this is a unique opportunity and an important community opportunity to tell your listeners that, please use trusted websites. We have a website set up again, michigan.gov/COVID vaccine. It's available in different languages. And, please just rely on trusted sources for accurate information.
Yeah, absolutely. Absolutely. Is there, and we really thank you, excuse me, we really thank you for taking the time to be with us and share this information with our listeners. Is there anything I haven't asked you that is important for people to know?
Well, one thing I want to reiterate, people may already know this, but I do want to let people know who is eligible right now as of the state guidelines and priorities. So as of March 1st, so as of yesterday, residents who are eligible include anyone over the age of 65, frontline essential workers such as healthcare workers, long-term care workers, and food and agricultural workers. So if you fit into one of these categories, please go to the website or call your local health department, see how you can sign up. Like I said, every county is doing it differently, so I'm sorry that I can't tell you exactly what you need to do, but hopefully some of the information that I've provided here at least helps people know where to go and find out more.
Wonderful. I want to thank you so much for taking the time to be with us this morning. And we appreciate all you do and everyone in the state that's doing to help us understand what's going on and keep us safe.
Thank you so much for the opportunity. And I want to say thank you again to all your listeners for allowing me to share this information today.
Absolutely. Thanks again. Appreciate it.